Welcome back, or those of you who are just joining, my name is Tina Costa and I am a director with the PHSA Office of Virtual Health. I continue to be your host for these virtual sessions today, and it's my pleasure to welcome or re-welcome you to the day 2 of the 2023 BC Digital Health Forum, inspired by Canada Health InfoWay's Digital Health Week. For those of you just joining our virtual circle, we encourage you to share in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of BC First Nations. As we continue to engage, learn, and collaborate in the realm of digital health, let us give thanks for the privilege to do so on these beautiful sacred lands, and may our discussions contribute to a future where Indigenous voices are uplifted and the principles of reconciliation guide our path together. I now have the pleasure of introducing our next presenter, Astrid de Souza. Astrid is a clinical exercise physiologist in the Children's Health Center at BC Children's Hospital. Clinically, she is involved in exercise testing, exercise prescription, and rehabilitation, and continues to work on developing ways to increase physical activity in children with pediatric heart disease. She follows a variety of children, including those with congenital heart disease, pediatric transplant, and adolescent dystomia. She supports the research program of Dr. Catherine Armstrong, pediatric cardiologist with a specialty in heart failure and heart transplant. Together, they have tirelessly worked to show the positive impact of text messaging as a means to increase communication, support behavior change, and improve care for pediatric patients. Please join me in welcoming Astrid on a talk about how a text messaging platform can impact care in a pediatric cardiology clinic. Astrid, all yours.
Thank you, Tina. Just gonna share my screen here. Can everyone see that?
We can, yes. Thanks,
Okay.
Astrid.
Perfect. So thank you for inviting me to speak today, and thank you, Tina, for the introduction. I'm here to share some of the work that I've been involved in through the research program of Dr. Catherine Armstrong. So our journey started in 2018 when Dr. Armstrong returned from her fellowship to support the heart failure and transplant program. What she was quickly faced with was patients like this in her clinic who looked like this, feet up, head down, not engaged in their healthcare. She was also faced with another challenge. Her heart transplant patients were dying because they were not able to manage their own care because their parents were the primary people responsible for their healthcare. So we sought to find a way to bridge communication challenges and to improve engagement for patients and their families in cardiology and with their healthcare providers. Young and bright-eyed, we thought the answer was an app, and we were quickly put in our place as someone with much more wisdom than us explained that an app would cost a fortune. So he introduced us to Welltel, a local company who are global leaders in evidence-based digital solutions in healthcare. Welltel had used SMS text messaging to engage with non-adherent HIV patients living in Africa. They worked from a secure web-based platform that sends SMS messages to patients using open-ended questions and working on the premise of asking patients how they are rather than telling them what we think they need to know. So what we did was we led a focus group with our adolescent patients with congenital heart disease. And we asked them, how did they want to communicate with their healthcare providers? They said Snapchat, we said no. And they said then the preferred means of communication for them was via text. So Welltel is a bi-directional web-based communication solution. It's based on the concept of ask, don't tell, and really was there to foster better communication with our adolescent patients. In addition, in cardiology, parents of children with congenital heart disease ride the roller coaster of clinical visits, surgeries, and weight checks, nutrition checks, and they can find it really difficult to find time to speak to their healthcare provider. For adolescents, who are navigating years of medical care. They're learning how to advocate for themselves and learn more about their condition as they grow up and prepare to transition to the adult world. So how does WellTel work? Well, every week, an automated message goes out on Monday at 12 p.m. and the message simply asks, "How are you?" The patient replies, and the system triages responses into 4 categories using natural language processing. So the responses are categorized into okay, not okay, unrecognized, or no response. If the patient says they're okay and they say, "Yes, I'm okay," they just go, we triage them to doing okay, and then we don't deal with them for the rest of the week. If a patient responds with no, or they give an unrecognized response where they've asked a question or started a conversation, that's when we respond. So as clinicians, we monitor the not okay and unrecognized responses. We do so within 48 hours. Our patients know this is a non-emergency service, so it's only in operation from 8 to 4, Monday to Friday. And generally, it requires about 10%, generally about 10% of our patients require follow-up in any 1 week. So here's the communication log that I, as a clinician, see. So this is all web-based. On the left-hand side, you can see our communication log and the categorization of the conversation. So these are all of our patients. The green is okay, the red is not okay, and then the yellow is unrecognized. The non-responders are also located there. We don't really go after the non-responders. Generally, research has shown that non-responders don't need care. And so those non-responders, again, go into a separate triage, and we don't engage any further with them that week. On the right-hand side here is a list of all the patients that I'd potentially be following. And then in the forefront here is what the communication log looks like for each individual patient. So what is WellTel's capability? Well, it can document care conversations, and care conversations are classified as any conversation with greater than 2 messages between patients and their healthcare provider. It allows us to do video calls using our own PHSA Zoom account. We can schedule appointments, we can text reminders, we can document patient notes, we can even monitor billing. And all of this can be exported to a CSV file, which can be uploaded into an electronic medical record or printed and put in a chart. So what was the aim of our initial work? Well, really it was to implement a bidirectional text messaging service to support patients and families seen in the Children's Heart Center. We started in June of 2018, and we included patients aged 10 to 18 years. Thereafter, we extended it to parents of children less than 10 years, and what everyone needed was access to a cell phone and a text messaging plan. Those who did not speak English or have access to a cell phone were not able to participate in any of our studies. So here's a schematic of our journey to date. So we worked off of the premise that research informs practice. And with the support of small seed grants from the Evidence to Innovation theme, we were able to do some preliminary work in 2018 with our multi-organ transplant program. This was the first pediatric test case use of WellTel. We then had a graduate student do some work with another population who needed constant support. So this was our dysautonomia population. So dysautonomia is a big long word. It is a condition where there's an imbalance in the autonomic nervous system. And what that plays out like in patients is that they get symptoms all throughout their body. So that might be increased heart rate, increased breathing rate, chest pain, purple extremities, nausea, all these things where they feel so debilitated from their symptoms that they find it difficult to go to school, they don't engage with their friends, and so on. So they needed a lot of support to try and help manage their condition. So this was a part of Claire Galvin's thesis work, was to implement a text messaging platform to support these patients. This really let us be set up for a seamless transition when the pandemic was declared. So by March 17th of 2020, we were seamlessly able to start seeing patients. And we just used the video call feature that was already present in WellTel to start seeing our patients. More recently, we've been focused on the spread and scale of this project. So what was some of our preliminary evidence? Well, with multi-organ transplant, in our multi-organ transplant program, we first implemented, this was our first group that we first implemented the WellTel platform in. So we recruited 23 multi-organ transplant patients. 3 patients experienced technical difficulties. Over the course of the study, over 1,000 messages were sent, and there were 375 care conversations. 95% of patients found the service helpful. They felt more engaged with their healthcare. 15% said the service helped them, excuse me, make their decisions about their medications. And 100% of patients would recommend the service to other transplant patients. In Claire Galvin's work, she, like I said, she was looking at our dysautonomia population. We enrolled 23 patients. The median time on WellTel was 33 weeks. 96% asked their healthcare provider at least one question. There was a 71% response rate. And then interestingly, in this study, it came out that 23% of our weekly message check-ins required follow-up by healthcare providers. And that really speaks to how challenging this population is, and some of the challenges that they're faced with, because that requirement of follow-up was a lot higher than what had previously been reported. So here's just a schematic of our participant enrollment. So you can see from 2019 to 2020, we're slowly increasing our enrollment through those 2 studies. At the start of the pandemic, at March 2020, you see an astronomical rise in our enrollment as we started to see a lot more patients virtually, but as well, we wanted to be able to reach out to our patients. This was some of the feedback from one of our participants during the pandemic. She was really appreciative of the opportunity to do a virtual appointment. She recognized it was a new experience, and then she thanked us for our sensitivity to being able to meet kids' medical needs during this challenging time. So this then just led us to winning a Digital Health Research Accelerator project. And the aim of that project was really to expand the use of WellTel to 1,000 patients in the Children's Heart Center. Again, we continued to use patient satisfaction surveys. We looked at conversational text analysis using natural language processing. We also then through a process called the MCFR, determine the facilitators and barriers to clinical implementation. We led a focus group, and the intention was to lead it with stakeholders, including patients, caregivers, healthcare providers, and administrators in the Heart Center staff. Here is what we ended up leading to through our implementation project. So here are some of the patients that are currently on the platform. So Dr. Armstrong's heart failure patients, some of our inherited arrhythmia patients, like I said, our dysautonomia patients. A lot of the patients that I see are followed through this exercise prescription group. And what's really interesting for me as a clinical exercise physiologist is I'm often asked or given the task of trying to change or help change somebody's behaviors around exercise. And so I really need a platform to be able to follow my patients pretty consistently, because these behavior changes take time, they take conversation, and they really take take time to kind of tease out what factors are present for our patients. So this was such an easy way for me to follow patients because up until now, I would have had to phone them or email them, all of which are difficult to do with teenagers who go to school during the day and really don't respond to email. Recently, we put our cardiac surgery patients on, and we are soon going to implement this with our cardiac catheterization patients. We looked at some of the themes of conversations through this study, and really a lot of our things that we were dealing with were symptoms or diagnoses or treatments. There's lots of logistical questions, so related to appointments and so forth. And it was just really helpful to understand, well, what were we talking about with patients? So through the MCFR process, again, we looked at facilitators and barriers. The first challenge that we kind of came to was that our ethics board didn't actually want our patients and caregivers in the focus group because they felt like they couldn't truly express their opinion and they didn't want to be coerced. So the feedback that we got from patients and caregivers was really based through our patient satisfaction surveys. What really came out from it was there was a lack of knowledge and there was a lot of misinformation amongst the administrative stakeholders. And this really led to a lack of buy-in and made it really difficult to expand to all our nursing staff. Despite all of this, though, more nurses in our clinic are using WellTel in a research capacity. So as we've moved through this journey, we've started continuing to try and show the efficacy of the WellTel platform. We recently delivered a virtual exercise program to our solid organ transplant patients across the province, and we used WellTel as a means of communicating with our patients. So we sent text messages throughout the program. The response rate was 40%, so it was lower, but it was lower because we were seeing these patients 3 times a week through this exercise program that we were running. The conversation themes were social, administrative, or about a medically related issue. And again, as I was saying, from my perspective, it really enabled me to be able to monitor behavior change goals. We've also trialed the use of this, like I said, in our cardiac surgical patients. So this was started in January of 2023. Patients were enrolled at their pre-admission visit. They were signed up for 1 month of weekly check-ins, and they were completed a survey at the end of the study. So 126 families were approached, 104 were consented, 87 were discharged, 11 are active, and 6 participants withdrew. Over the course of the study, there's been about 2,700 text messages sent between patients and healthcare providers. Pardon me, 63% have received a response. There have been 309 care conversations between healthcare providers and participants. And on the right-hand side, this is a categorization of our care conversations. So 51% had really no health concerns. 39% had a health-related concern, and I can't do my math quickly, and I see that my slide is lost its percentage, but the rest of the concerns were administrative. And then just of note, when we looked at this health-related group, 30% of those conversations were pertained to surgical wound healing. The next things that we asked were, we were trying to figure out if our patients found it helpful to text their child's healthcare team. Overwhelmingly so. Same with, did they feel better connected to their child's healthcare team? Again, overwhelmingly so. Sorry that that slide hasn't come out quite correctly. I'm not sure. I've checked these before. In terms of feedback, it largely has been positive. And it's been really striking to see what families have had to say. Knowing that they had a point of contact, being first-time parents with a baby with a heart condition, comforting to know that there was someone there after trying to heal from a major surgery. recognizing that sometimes they just had a simple question, and it was really nice to hear that from a nurse. And really feeling like the service filled a gap. And then, strikingly, making it easier to get a hold of someone and preventing a visit to the emergency room, which I think is really important feedback to have. Of course, I think it's really important to look at negative and constructive feedback. A large part of that was around frequency of messages. This person didn't find it helpful, but then did say that they found it helpful to be able to send a photo or a video. Some people say it's annoying to get a text message. Some people talked about the delay of response, but we clearly said we would respond within 48 hours. And then they were saying it would be great if there was something after working hours. Again, we were very clear that this ran 8 to 4. So what we have learned and what are our next steps? WellTel has allowed the Children's Heart Center to increase communication and engagement with patients and families, and allow the healthcare team to provide supplemental patient care. We continue to work closely with the Office of Virtual Health, who have been very supportive of our work thus far. And we need to do further work on how implementation can affect clinical workflows. And with that, I'd just like to thank the members of Dr. Armstrong's research team, Dr. Jim Potts, Chris Buckland, Claire Galvin, and Pearl Warwick, and the WellTel team, who have been so incredibly supportive of all the work that we have done.
Astrid, thank you so much for really sharing how the shifts that you and your team are making can truly empower our patients, particularly those in the pediatric or youth age range, to be full participants in their care. It's really a great example of how our whole system needs to adapt to the patients' and families' lives versus what we typically do, where they have to adapt to how our system works. So thank you so much. A great presentation. We have a number of questions. We don't have time for all of them, but I'll I'll ask the first and see how much time we got.
Okay.
Excellent presentation and innovative project. This individual is curious about WellTel's natural language processing capabilities. Can it process and respond in multiple languages? And double-edged, does it account for the cultural background and personal preferences of patients?
So I can't speak to all of that. Like I said, this was originally done in Africa. And to my understanding, the messages went out in Swahili.
Okay.
So there must have been someone on the back end triaging those responses, but there was definitely that piece around language in that situation. I'm not the best person to speak about the natural language processing. Obviously, I'm a clinician, and so I try to stay out of that. But definitely questions I can ask moving forward.
Great, thanks, Astrid. Maybe one quick question. Someone's just wondering about the alternative measures for those patients and families without, say, SMS access, or those in a remote community. How do you guys manage that?
Yeah, like interestingly, I thought about this a lot, even when I was looking at our exclusion criteria, because I think culturally, or you're starting to, you basically aren't giving access to people who might not have money or like self-service access. So we recognize that for the purpose of what we've been doing, have had to just continue to go forward, but just recognizing that in some places that can be quite difficult. And this is definitely an SMS thing, because some kids, for example, don't have a phone. And so they want to be able to use iMessage to do it. But I think it has to come through as an SMS message. It can't come through an iMessage.
Fair enough. Well, thank you for answering those questions. Encourage those who have more questions to reach out to Astrid and her team to learn a little bit more. There are some great questions in the queue that unfortunately we don't have time to get to. But again, just want to say thank you, Astrid, for a great presentation. We'll close here. And as always, just send up a little poll here for you guys to give us a bit of feedback. and we'll invite you to join our next session, which is entitled Starting to Answer the $1 billion Question, Realizing Electronic Health Record Benefits. And reminder that you can navigate to that next presentation by going in and physically clicking on the session title on the panel, which is on your left-hand side. Thank you again, Astrid.
Thank you, Tina.